quivering.
Quivering.
Teeth marks.
Teeth marks.
Swollen.
Red spots on the front. Okay.
Slight crack down the middle with fissures.
Is that
yin shu.
Yellowish patches on the back there, lower jowl? See the back there?
You've got papillae at the back. Do you think it's yellowish? It might have.
It looks yellowish.
Okay. Do you think it's a slightly purpley?
It is, isn't it? It's like stagnation there, isn't there? So it's a purple hue.
Yeah, down the middle and red at the sides. But I think the spleen tissue, there's some perhaps dampness in the lower jowl, a stomach crack, yin shu fissures, slightly redder
There should be
at the
some heat
front.
somewhere. It looks yellowish at the back, the lower jowl.
Well, it's red at the sides, which is what liver heat. Do you drink alcohol? I bet you don't, do you?
No, he's not. I think it's quite pale, but also quite pale and purplish.
Purplish, yeah.
So there's
Some blood stagnation.
yeah, but quite pale is almost like kidney yangshu.
It's not very, very pale though.
No,
Do you think?
I think it's pale for his age.
Okay.
So what are you finding then?
Just started doing the first stage on the left, and pulse is not present floating, but it's present slightly superficial.
Okay, so yeah.
That's as far as I've got so far.
Okay. Have you looked at his tongue yet, or not yet?
No,
Okay,
no.
okay. Well, we'll come back and check it out later.
I think there's redness around the cheek here
Yeah.
and around here, like an indication of heat. I think I can see a slight colouring around the eyes and around the mouth, which is a yellowy kind of greeny colour. The tongue is swollen.
Let's have a look at the tongue.
It's slightly swollen, and there's if you go further back, there's a very slight crack in the middle, and then in the back and the lower jowl, there's a yellowy coating, and it's raised.
What does that mean?
Damp heat in the lower
Damp
jowl.
heat.
In the lower jowl. I'm not sure about this bit here. Just kind of see there's a bit of redness,
That's lung heat over there.
which would indicate. Yeah, okay. And it's a very slight red tip on the tongue as well. Very slight, and
Okay. Well, that's an indicator of heat as well.
yeah, and heat. Okay.
Well, I think you might have a bit of maybe a liver chi stagnation, and I think
Blood stagnation. He's got heat in his
liver blood actually could be liver blood, couldn't it? And the heart is very wiry, so yeah, it feels wiry. Let's try the heart. It feels wiry.
Do you agree, or you find it different?
No.
Okay.
not wiry.
What's that sensation I feel?
Liver's tight, yeah.
Tight pulse.
Yeah, the liver.
That's just because on that stagnation. If it's tight.
Well, you've got to remember that this is the weather. You know, in the spring, the energy comes into the liver, and the weather's changed from cold into warm weather.
Right.
And there's
Transition of the elements.
this is where they call it evil warmth at spring. So it affects the liver. So the liver's becoming agitated by the sudden change.
Okay.
So it's quite normal for the liver pulse to play up at this time. So what are you finding?
Well, the left pulse, the right pulse is more full, and the front position on the right pulse is quite different to the left. It's more full again. It's the strongest. Really, it's the one that stands out most on this side.
Yeah. And what
Whereas
does that?
the middle position on the left side stands out more.
And what's that telling you about her health?
Well, you know, it could mean that there's a recent, pathogen, but at the same time, she's just finished her menstrual cycle, and so it also might mean that there's, that the right side is chi, left side is blood. So in that regard, it was not so surprised that the pulse on this side would be stronger. But there is a difference between the pulses. Trying to work out exactly what it means is, I suppose the key.
Okay. And what about on the face? Have you noticed in the facial colour?
Well, I mean, it's a bit difficult to tell with the green jumper, maybe that might be adding in.
Thing is, if he's actually
I mean,
fit, you would expect like a
Have you seen her tongue?
Yeah, yeah. I mean, the tongue is, the tongue has darker spots on it, and and there's a redder tip, and it's moving as well. There's a sort of pale coat, thin coat at the back.
And what's that telling you about her?
Well, the red tip, obviously heat. The darker spots would be stasis, I suppose.
Stasis where?
Well, front, we can see them in the front position here, so that'd be lung. Isn't that lung? Front sides.
Okay.
And liver, but they're not really enough on the sides, I don't think, for it to be liver. And
she's got some kind of grey patches on the sides, hasn't she?
And the lips are quite a sort of, she's got quite dark coloured lips.
Yeah.
But, she's got a dark complexion. It's difficult to know, really, if that's not just normal. And the lower lip is slightly pinker, I suppose. And there's a sort of a line around the edge of the lips. It's slightly darker again.
What does that mean?
Isn't that also blood stasis?
Yeah, blood stasis in the liver.
In the liver.
Liver and spleen.
Yeah. I mean, that sort of thing. I mean, I don't really see any dark rings around the eyes. I mean, most of it, for me...
What about in the eye sclera?
Let's see. Can you look up? Yeah, I mean, we can see on the lateral side of this eye here, there's some redness here, which is lower. Here, yeah. So that's
in the lower body cavity.
That's lower jowl. Yeah. If you could look down, Nima, so just to see above. Yes, it's not so bad above the
something
pupil.
on the medial side,
which is lung, isn't it? On the. But I think that on the sclera, really, it's to the side of the eye here, I think, where we've got the most redness.
And that's quite distinct redness, though, isn't it?
And so, I mean, I say this is, knowing what we know.
That's actually large intestine. Yeah. Lung, it's lateral to the lung,
right.
Large intestine.
Yeah, knowing what we know about Nima, and her medical history, this kind of all fits in.
So, what is her medical history?
Crohn's, don't you? And I mean, that's really all that I know is the sort of standout thing. But also, she's just recovered from a virus. So treatment principle, I'd say would be really it's about trying to regulate the middle jowl, possibly clear heat, to regulate the liver. So that we don't have any liver invading, so aid with the digestion. I mean, as well, I'm not, and also because it's the end of the menses, I'd also think about trying to nourish blood by regulating liver. That would sort of be my aim, my focus.
Okay, well, we'll come back to you in a little while and see how you do your treatment.
All right.
We're going to hear what's really going on. Come on, Anna.
Okay, well, I had a little bit of a wind cultivation. Yeah. A little bit, but just on the nose, but it was like barely minimal. But the main thing I got is like a pathogen, latent pathogen in my body.
Yeah.
Like I had like a infection gone straight into my blood, into my nose, and it spread to my eye about 5 years ago. And I took antibiotics and it helped it, but I have a little bit in there and it flares up when my immunity gets low.
Liver blood stagnation, liver blood deficiency, a weakened immune system, kidney yin deficiency, a fullness in the lung which is pathogen related, spleen qi deficiency, and damp heat in the lower jowl, heat in the upper jowl. So we thought we'd do a 5-minute back treatment, do 14 in and out to clear heat, to reduce lungs, bladder 13, bladder 23, kidneys reinforce, bladder 18 reduce because of the liver heat, and then just for 5 minutes, and then we'd do a front treatment, liver 3 reducing to move liver qi, kidney 3 reinforcing, bladder 60 to reduce to balance that, spleen 6, 9, 10 reinforcing, reduce lung 7 in case the pathogen is lung pulse is very full, reinforce stomach 36 to reinforce his spleen, reinforce gallbladder 41 to get chi moving, and reduce gallbladder 34 to balance that. What do you think?
Yeah, well, I like the sound of what you said, and I thought reinforcing the spleen meridian has got to be because of the lowered immunity with the sunken papillae. And I think doing a clear wind off the back treatment's going to be good to deal with any acute wind. And I think clearing heat of the system will be good. So I think that that should make him feel stronger and better. And then when you have him lying on his back, you can do large intestine 20.
Spot on.
Yeah, so what our diagnosis you think was fairly spot on?
Yes, I do.
And the circulatory system?
Circulatory system, I can attribute that to one of the valves. Is a little bit slow because of going to the dentist. A cardiologist told me you're okay, but that one of the valves was infected because of the going to the dentist and swallowing the...
Okay,
so you get that irregular...
from the abscess, the abscess material.
Yes,
and the fact that we picked up a problem on your liver and the fact that you were angry kind of tied in.
Right now I'm very angry.
Yeah, okay.
I normally don't have the outlets I have for exercises that I normally do.
Okay, so you're really quite stressed.
So,
okay, I'm going to ask your practitioner what treatment she suggests.
Okay, what we thought was we'd clear heat first.
Right.
So it's going to do a back treatment.
Yeah.
Tony's got problems with. So we thought we said say jump, certainly T9 and T10.
Yes. I would really recommend that.
Plus the bladder beside, possibly T5. I don't know what you think.
Yes, yeah. Yes. I would go with the Wato Jachi points on this one.
Right.
Because you can quickly relieve the stress on the circulatory system, and also it's really strong on clearing the liver excess, and that will be contributing to the anger feeling.
Right. So then take those needles out.
Yeah.
And then we were going to do for the insomnia. We said we do the neck and shoulders, but we do and Mian. That. Then gallbladder 20, gallbladder 21, bladder 10.
Right, yeah, we did bladder 11 as well.
Yeah. Then we were going to do the kidney formula because we thought his kidneys were a bit deficient. So do to bladder 23, bladder 24, bladder 52, kidney 3 and bladder 60 anyway.
Yeah.
Then we wanted to, we thought there was a bit of blood stasis.
Yeah.
So we weren't sure of the point. We did say gallbladder 40, but I don't know if that's what you think about that.
I think treating the liver would be good for that. I think you've got to do... what I would do with him first is I'd have him face down.
Yeah.
I'd do T5, T6, T9, T10, L2 straight away. Leave it in for 20 minutes, half an hour.
L2.
Leave it in for 20 minutes, half an hour. Okay. And that will calm him down straight away. Right. And it will relax the liver, and already he'll start to feel a lot better.
And that's
then you can add the points for the insomnia on the back of the neck. That's fine.
And the neck points.
You could do them at the same time. Okay. You can do them at the same time, and then turn him round, and then you can do the other treatments, the extremities.
Right.
So the extremities, you obviously got to do heart 7, possibly pericardium 6. Yeah. Okay. Liver 3. Because of his age, I would do bow jump on the yin system of the medial side of the legs.
Right.
Generally to strengthen the spleen and the kidney.
So
spleen 6 and 9, and kidney 3 in reinforcing.
And so then bladder 60 reducing.
Bladder 60, yeah.
Spleen 6, 9.
Yeah.
Yeah. Okay.
Yeah. And then you can do the stomach because he's been eating badly. He's got some green around the lips.
Yeah.
So I would do CV12. I'll do CV12, CV17 reducing to help the digestive flow.
Okay.
And I would just do the lungs anyway. Just because you strengthen the lungs anyway.
So
kidney 27, yeah. But just use half-inch needles there.